Endometriosis. This occurs when the tissue that normally lines the inside of the uterus, that's the endometrium, grows outside the uterine cavity. It may involve the ovaries, the fallopian tubes, the tissue lining the pelvis, and also the rectum. The ovaries and also the fallopian tubes. Welcome to SR Medicine. Don't forget to subscribe. Notification button, like, share. When endometriosis involves the ovaries, cysts called endometriomas may form. Usually the surrounding tissue may become irritated, eventually developing scar tissue. Those are adhesions, the bands of fibrous tissue that can cause pelvic tissues and organs to stick to each other. Endometriosis causes severe pain, especially during menstrual periods. Fertility problems may also develop. Usually, such patients do not respond to NSAIDs. Symptoms of endometriosis: painful periods, dysmenorrhea, pelvic pain and cramping may begin before and extend several days into menstrual period. Commonly occur in young women between 20 and 30 and also 30 and 40. Lower back and abdominal pain. Pain during or after sex is common with endometriosis. Pain with bowel movements, dyschezia, urination, pain during urination, dysuria, especially during menstrual period. Excessive bleeding, occasion heavy menstrual periods or bleeding between periods, that is intermenstrual bleeding. Infertility. It may also be a sign of endometriosis. Sometimes the endometriosis is first diagnosed in those seeking treatment for infertility. Other signs and symptoms may include fatigue, diarrhea, constipation, bloating, or nausea. These occur during menstrual periods. It is always good to differentiate endometriosis from other conditions which may also cause heavy pelvic pain and heavy bleeding. They are gynecological and also non-gynecological. Other conditions which may cause pelvic pain may include pelvic inflammatory disease, PID, polycystic ovary syndrome, adenomyosis, also fibroids. These ones have similar symptoms with endometriosis. Irritable bowel syndrome, inflammatory bowel disease, interstitial cystitis, constipation, and abdominal cramping. Also, these present similar symptoms with endometriosis. Usually, whenever there is irritable bowel syndrome, it can accompany endometriosis, which can make diagnosis complicated. The four main symptoms, the 4 Ds of endometriosis, include dysmenorrhea, painful heavy bleeding during menstrual periods, dysuria, painful urination caused by ectopic endometrial tissue on the bladder, dyschezia, painful defecation also caused by ectopic endometrial tissue on the rectal area, and also dyspareunia, painful intercourse caused by sensitivity of the GI. There are many possible causes or theories that may explain the movement of the endometrial tissue to other areas outside the uterine cavity, including retrograde menstruation. Menstrual blood containing endometrial cells may flow back through the fallopian tubes and into the pelvic cavity. These endometrial cells stick to the pelvic walls and surfaces of the pelvic organs, where they grow and continue to thicken and bleed over the course of each menstrual cycle. Vesicular and lymphatic dissemination of endometrial cells. Uterus is well supplied by blood vessels and also blood vessels that do drain blood. The blood vessels or tissue fluid may transport endometrial cells to other parts of the body. Ceramic metaplasia of multipotent cells in the peritoneum cavity. Transformation of peritoneal cells. There are factors that promote transformation of peritoneal cells that line the inner side of the abdomen into endometrial-like cells. Embryonic cell transformation. Hormones such as estrogen may transform embryonic cells in the early stages of development into endometrial-like cell implants during puberty, surgical scar implantation, usually after a surgery such as hysterectomy or C-section. Endometrial cells may attach to a surgical incision. Immune system disorder. This is a problem with the immune system may make the body unable to recognize and destroy endometrial-like tissue that's growing outside the uterus. Risk factors: never giving birth, starting period at an early age, early menarche, late menopause, short menstrual cycles, heavy menstrual periods that last longer than 7 days, having higher levels of estrogen in the body, or greater lifetime exposure to estrogen may also increase the risk. Low body mass index and low birth weight, one or more relatives with endometriosis, that is family history. Any medical condition that prevents the passage of blood from the body during menstrual period may increase the risk. Disorders of the reproductive tract, some genes, eating a lot of red meat, obesity. Endometriosis usually develops several years after the onset of menstruation. Some good news: signs and symptoms of endometriosis may temporarily improve with pregnancy and may go away completely with the menopause. Complications: infertility, autoimmune disorders, mental health challenges, adhesions, ovarian failure. Preventive factors: fruits, vegetables, multiple pregnancies, prolonged lactation, omega-3 oils. Diagnosis is somehow difficult. That's why it is always good to differentiate endometriosis from other conditions which cause heavy bleeding and heavy pain. A pelvic exam may be done, ultrasound that pictures the reproductive organs, ultrasound scanning one into the vagina or across the belly to find out ovarian cysts. These are common with women that have endometriosis. MRI makes clear pictures of the inside of the body. Then laparoscopy to check for signs of endometriosis. Also laparoscopic surgery to look for endometriosis. Speculum exam to reveal deposits in the vagina. Also bimanual exam to reveal a fixed uterus, fixed cervix, tenderness deep in the vagina. Also pelvic ultrasound to reveal large endometrioma. Management and treatment: pain medication, first line NSAIDs such as ibuprofen, hormonal therapy, oral with combined estrogen and progestin. This is a synthetic form of progesterone to prevent ovulation and reduce menstrual flow. Progestins alone or gonadotropin releasing hormone agonist, ovarian hormone production, creating a sort of medical surgical techniques. Laparoscopy also used to help diagnose endometriosis. Hysterectomy, easing the pain of endometriosis, relaxation and medication. Take a warm bath, prevent constipation, get regular exercise, use a hot water bottle or heating pad on the abdomen. A combination of medical and surgical therapies, traditional Chinese medicine, nutrition approaches, homeopathy, allergy management, immunotherapy. Then treatment of infertility in endometriosis, clearing of adhesions by surgery, removal of endometrial mass in the ovaries. Thank you for watching. Don't forget to subscribe.